campaign committee and the campaign management committee has been announced the composition. How do you look at the composition, sir? Bommai is heading and Yediyurappa, you, all of them.
Yeah, obviously, our Honorable Chief Minister has been the face of the whole fight. And of course, our senior leader, who is like a mentor to many politicians in BJP, and the most charismatic and mass leader with mass appeal, Mr. BSY Yediyurappa ji is trying to support the cause. He is trying to lead from the front, and he has shown the new age politics in this country. What a mentor should do after a certain age, what is the kind of graceful exit. After graceful exit, what is the way that a senior leader should behave and how he should protect the interests of the party. So he has really given a new benchmark. A lot of times you must have seen in other parties, people after demitting their office or politicians who are removed from their offices unceremoniously, unlike our Yediyurappa ji, has really shown the path. Those political leaders, they have started their own parties in certain areas. Some leaders have gone against their own parties. He has shown that he is a sincere party functionary who has believed all along the ideals of the party.
So, what is your realistic assessment of the situation, sir? Party may be claiming 140, 150. That's what Congress is also saying. That's what JDS is also saying. Since you're on the field,
it is a very important and it is a tricky election. It is a tight election. I wouldn't say that we will be getting 140, 150 seats, but we are striving hard to form the government on our own. And I strongly believe that will happen because of 2-3 reasons. One is that people of Karnataka have seen the coalition governments in the past. Either an economical growth or the development of the state depends on a lot of political stability. The political stability comes only when there is a single party which forms the government. And people of Karnataka also have realized many a times we have always voted a different party in the state while there is a different party at the center. And when that happens, we have really suffered in a way from the funds point of view, allocation of the funds point of view, development, the smooth, arrangement between state and center. When there is a same party in the state and center, there will be more support from the center for all our infrastructure projects. For example, the kind of support we are receiving in only one sector, I would like to give an example this time. It's like railways. They allocated more than about 7,500 crores to Karnataka state, which is almost 9 times higher than what we have seen during UPA regime. It used to be hardly 700 or 800 crores. So this is one sector I am trying to tell you. So the state, if it has to be benefited, it has to be a same party at the state and center. That is a double engine. This is what we call as double engine governments. And this really benefits the people of Karnataka, the development of Karnataka.
So that is your assertion, but what about the anti-incumbency factor? To what extent it may impact?
every party, while they are in power, they will have an anti-incumbency, and this government also has an anti-incumbency. I have no doubt in my mind. But whether you can beat this anti-incumbency and still form a government is what the question is. Even as an individual MLA, even I will be having some kind of anti-incumbency in my constituency. But whether I will be able to beat that and convince my people that yes, this is the kind of development, this is the kind of work that we have done in the most challenging times. Government in the normal condition and in an extraordinary condition, there are two different aspects to it. I always feel pre-COVID era is totally different from COVID and post-COVID era. This government had a unique responsibility of handling not just the saving lives. We had the responsibility of saving lives. At the same time, we ensured that livelihood was not hampered of any people. Even this is the government. This was the only government probably I know. We have never reduced or there was any salary cuts for any of our employees even during those turbulent financial years. There was a lockdown all over, there was no GST, there was no taxes coming in, there was no revenue. In spite of all that, the government ensured we provided that social security for the people, the health care to the people, education, all the basic necessities, we ensured that people had it. Of course, we had to face two, I think, the floods episodes consecutively. When Mr. Yediyurappa ji was the chief minister alone, even without the cabinet, he had not formed his cabinet. He was the only minister, he was the only chief minister in the cabinet who had to handle the flood in the first year, that was in 2019. Then again in 2021, as you have seen. So we have faced two biggest floods. And in spite of all this, when people try to weigh us, try to analyze, they should really give credit to this government that they have done our best in an extraordinary situation. And today our economy, we can substantiate this with the present, economic growth of this state, because we have reached or we are much better than the pre-COVID era today. January 2023, if my memory is right, it's more than 6,000 crores of GST that we had in Karnataka. So that speaks volumes about this government. We are doing our fundamentals right, be it Yediyurappa ji or Mr. Bommaji. We ensured that this government adapts to the situation and also provides the best care, the best development to this state and the people.
So do you think COVID will be like a factor for USP for election campaigning?
Why not? Why not? When the countries around us, neighboring to us, the neighboring countries, they are facing huge debts. Today the milk in Pakistan, Sri Lanka, it is almost, they are fighting for a glass of milk. Their fuel prices have skyrocketed, 400 rupees per litre, 500 rupees per litre. US, if you see people talk about fertilizers and manures, they should ask what is happening in US, what is happening in Europe. And still, I am not disputing that India also we have a price rise, but please compare apples to apples. UPA regime, it was a very normal situation. What was the growth rate? And what was the inflation then? Inflation is always there in every government and in successive years. But here, this government under Modi's regime, they have done amazing work by doing a fantastic diplomacy. No country could have, done the way Mr. Modi has done today. In spite of this Russia-Ukraine war, this conflict, he was able to convince the world that it is very, very essential for a country like India to buy crude from Russia. Otherwise, things would have been totally reversed. People should understand these things. Everything cannot be told in the media.
So since we're on topic of COVID, just one
Yeah.
supplementary question. Now COVID, we're almost through COVID, and Karnataka, you did a phenomenal job during COVID. As a health minister, what were your apprehensions and challenges at that point in time? Now that we are through,
Yeah. To begin with,
because everything was new that point in time.
To begin with, we were clueless. As doctors, we were clueless. As healthcare professionals, were clueless. So you can imagine what the government could be going through then, could have gone through then. So in that also, I should really congratulate our Honorable Prime Minister for his great vision, the kind of commitment he showed in, the kind of statesmanship that he showed in, because in a federal structure like this country, he took every state together, irrespective of, we know that there are several states with several different political parties at the helm of affairs, with different mindsets, different ideals. Still, to face COVID, it was like a warlike situation. We handled symptomatically how we deal the diseases or infections symptomatically, how do we treat. Similarly, as and when the things evolved, we were trying to learn from the world. Fortunately, India was about a couple of months late than the other countries. For example, COVID started in China, Wuhan. It went to Europe, certain Far East, Eastern countries, US, then it came to India. So in that 2 months was very pivotal, and we learned from their mistakes, or we learned from their experiences. So that has given us a lot of window. It has given us a 2 months window period, and we could, luckily the first wave we could handle it flawless. I do agree the second wave we had to struggle a lot, because nobody believed, nobody had a clue that the Delta variant that we saw could create such a havoc, because the kind of oxygen usage, it was unbelievable. Never in the history we have used oxygen the way that we have used in the second wave. And you should have seen the way how we upgraded our facilities, right from infrastructure, creating oxygenated beds from hardly nobody cared for the healthcare. In the last 75 years, if you see, people think that we speak politically, but the matter of truth is that there was no sufficient infrastructure, there was no sufficient healthcare professionals, facilities. We augmented at least by 5 to 8 times in a span of 6 months. That is the speed in which the governments handle. Speed is one, and the size is the another one, because the country of this size, really we cannot be prepared for any kind of a pandemic of this size. For any kind of a pandemic, any kind of preparation is not enough. But still, international media have observed their editorials, their quotes. They were all apprehensive of Indians handling the pandemic. They thought millions of Indians, their bodies would be seen on the side roads. These are the vague remarks they had done. But we have taken it as a challenge. We have shown the world that India, when it comes to taking challenges, when it comes to saving our lives of our people, we can do better than any other country, better than even the most advanced countries, most wealthy countries. And not only that, even during such crisis, our Prime Minister, when I was telling, he has shown that statesmanship, leadership, by not only donating vaccines to dozens of countries, poor countries. So that time, you knew that US or China, they were not able to export, or they were not able to give vaccines. But this is when India not only provided vaccine, the Indian homegrown vaccine was developed. When you talk about vaccines in the earlier times, after it is come to a Western world, we used to take 15, 20 years to reach India. So, number of vaccines I can quote. It can be BCG, it can be hepatitis. There are so many vaccines. Every vaccine has come minimum 10 to 15 years after that has hit the international markets. But this is the first time in the history of medical sciences that a homegrown Indian vaccine was developed. Oxford AstraZeneca, our Hyderabad-based Covaxin. This speaks volume, because an honorable Chief Minister, from the beginning, he understood that vaccine is the only way forward. Though there was no vaccine, but he knew we need to control the pandemic. But meantime, the only way to beat this pandemic is to develop the vaccine. He was very, though he is not from a medical background, somehow he has understood the basics of it. So from then he has spoken to all vaccine producing organization, research and organizations. So he has prevailed upon many of them, and he has supported them financially, morally, as a leader. So I think a big thanks to our researchers and our scientists who could compete with the world and come out with this vaccine along with the vaccines of US, Russia and China. So this speaks volumes of our scientists as well.
So being a doctor helped you, sir, in that time of crisis, and helped.
Yeah, definitely. No,
To understand
see,
and take quick
as an
decisions.
administrator, if you know the basics of the pandemic, it will definitely help us. So I think I was fortunate, and I always feel I am blessed because I never thought I'll be a. I had only medical education ministry to start off. But after COVID, after few months, our Yediyurappaji, our Honorable Chief Minister, then he felt that a person should handle both healthcare and medical education. Otherwise, a uniform command could not have. Uniform command always helps instead of two commands, because people, the medical education had the tertiary health services as medical colleges. Health minister had this primary and secondary healthcare facilities, and all the hospitals come to him. So holistically to handle it, it was challenging, and it was very satisfying also at the end of the day. We have gone through a lot of hardships, but at the end of the day, when we look back and see, we really feel satisfied. We have done a great service to humankind. We have saved a lot of lives in Karnataka, and the healthcare is in the next level in Karnataka, especially the government health sector. Seeing is believing, so I always tell my media friends and other people, please go and see what the healthcare in the government institutions, how good we have done. There's a lot of transformation, I can say. If you see certain hospitals in government sector today, you can compare to any modern corporate hospitals. It's much better than that. And this government is very sensitive also towards the healthcare, especially like dialysis cycles. Initially, it had only 30,000 cycles per day, and today, unfortunately, we have the tag of being called as diabetes capital of the world. So we have understood the kind of demand we have. So from 30,000 we increased to 60,000 last year, and this year further we have increased to 1 lakh cycles per day. And even with cochlear implants, we all know that the children with hearing defects, it starts from birth, and it's not just one time solution. They have to go through surgery, then speech, and there's 3-4 multi-departmental approach, multi-sectoral approach. So it takes almost 6-7 years for a complete solution. So we have come out with that, and we have increased from hardly 6-7 cases they used to do per annum. Today we are doing 500 cases in a year. So, and it is quite expensive treatment, which costs at least 4 to 5 lakhs per individual. So you know that when it affects a poor family, it is really impossible for them to even be accessible to this kind of a treatment. So like this, there are several initiatives that this government has taken in healthcare. In the urban sector, if I am talking about, there is a lot of below poverty sector, the slum dwellers, that is predominantly in certain pockets of the city. Because healthcare always sees about availability and accessibility and affordability, of course. So we ensured that even these people should get the primary and the secondary health care in the vicinity of where they dwell. So that is why the unique concept of Nama clinics that we have formed. It's about 438 Nama clinics ಮಾಡಿದ್ದೀವಿ. Already more than 250 is operational. Similarly, women-related healthcare also. We are starting an Ayushmati clinic in 3-4 days now. Adu kuda more than 250. Exclusively for women-related issues.
We cannot also forget this Chamrajnagar incident, sir. Oxygen, some lives lost because of lack of oxygen facility.
Yeah. See.
Was it administrative collapse or administrative communication gap?
No, as an individual, as an administrator, I really felt very bad, and I really feel pity for those lives. But that was a time when the administration of both the districts should have been much more active, alert, and they should have handled the situation. In spite of all this, as a health minister, I felt the need of visiting, even ahead of a minister or even ahead of any others going in there. I was the first person, though knowing the ground realities, I was the first person to visit and take all the blame for visiting. But still, we have ensured oxygen supply even to a hospital with only 6 beds, 10 beds, who are operating, who are handling the situations, ICU and all, using the cylinders, oxygen using cylinders. You know that within 2 days or 1.5 days, we need to replace the cylinders. You can imagine there were hundreds and hundreds of hospitals, small nursing homes who used to operate. In spite of me coming out and telling them that minimum bed strength should be 50. More than 50 bedded hospital only should handle these kind of situations. But because in the second wave, people had realized that treating a COVID patient means a lot of money also. Unfortunately, the private, they felt that this is a good revenue. The challenge was for the government to provide them the oxygen. So I've taken so many calls during that time, I can still not forget. Some people used to call me and tell me literally, sir, I have only 1 hour, 1.5 hour left. If you do not supply, there are 3 patients on ICU, on ventilator. So I need this. There will be somewhere very in the midst of some areas where it is very, very, dense areas. But still we have managed lot of, situations like that. One unfortunate incident was in Chamarajanagar, which could have been, this situation could not have surfaced or it could have been avoided if both the district administrations could have acted efficiently.
In a coordinated manner.
Yeah, coordination should have been much better.
So a couple of them joined, who joined along with you to BJP in 2019,
Yeah.
seems to be not happy.
Has anybody
Vishwanath joined Congress. There is others that Narayan Gowda is not, according to the media report. But does all these make an impact in the upcoming elections, sir? So,
See, just before election, this kind of switchover is always bound to happen. We have seen in the past, and this may happen even this time. Few people may come this side and few people can switch from this side to that side. But that will not have any impact in the minds of the people, according to me. That is why, to begin with, I have told you what will be the reason, and in the from the perspective of a voter, he will only see what is good for the state, what is good for himself. And I am sure people are quite sensible, educated, aware of things. Unlike in the past, today electronic media, social media platforms, reading habits have all gone up. People have become more aware and educated. So they would be infused with so much of information than ourselves. So I'm really confident that people are intelligent and they will take a right approach and they will vote right person and the right party, because they know that it is a 5-year game. And you should also think that our party had not got a mandate naturally, even in 18. So after people like us, because of our conscious decision, I always felt from the day one, when an unholy alliance between JDS and Congress took place, I was the first person on the first day deferred that idea, and I voiced my views openly against this. So I maintained it, and I always felt, though you are elected from a political party, an individual should have his say. There was no meeting whatsoever, even in a legislative party. For example, I won from Chikbalapur. By the time I reached Devanhalli, they had announced the coalition. They had announced the leader. So this is not democracy.
Perhaps Siddaramaiah was also against that. at that
No,
point.
but he was helpless. He had lost his personal election as a chief minister in one area. So I came and I really asked him. He had no answer. He was actually clueless of what was going then. I literally saw him. I was not seeing the person whom I had seen for the last 5 years. That day he was not in his normal sense
He was upset.
because he was totally taken aback. He was shattered by the result because I knew one agency what they had predicted. They had given us 136. So he believed it. He had believed it. He thought at least 125 to 130 he will get it. So I think he could not believe the result. So in that grief, in that hour of grief and shock, he had played to the hands of the high command, so-called high command in Congress, and people like us had to suffer for such decisions, political decisions, which was not required. Actually, Congress could have stayed as an opposition because Congress had lost the election. People had not voted for us. They had not given us mandate. From 121, if you are brought down to 78, why do we have to do a government? We could have sat in 5 years in opposition. We could have played our role as a opposition party. That is the beauty of politics.
I think
But
to-
going by the survey, sir, none of the political party has got the majority number according to the survey. Do you think that the history will repeat the coalition government?
I hope the wisdom prevails in the people of Karnataka. So, the last thing that I expect is a hung assembly. People should really understand what is the wrath of the coalition government, how bad it would be for them. And I really appeal to people, please vote for development, vote for political stability, vote for Sabka Saath, Sabka Vikas.
So
Sir, right now
Modi's
there-
visit is likely to work as a booster dose for BJP to overcome anti-incumbency.
Courts is the most popular leader in the country today that we have, and people really love him for the way that he has carried forward in the last 9 years. So Prime Minister, whenever he visits, he creates that aura around him and the area that he visits, and there will be a percentage of increase in that area. It will be a politically advantageous for the party. As a Prime Minister, whenever he comes with a lot of commitments, lot of announcements, inaugurations like this 10-lane Mysore to Bangalore in the last 6 years, that giving so much of funds and ensuring that they have completed this historical developmental project. Today is coming to inaugurate this on the 12th, I think. So whenever he comes, there is a goodwill generated in that area. When he comes on 12th, definitely that goodwill will help the BJP party to an extent.
So so the health politics and the vaccine politics is on the rise. I mean, you're smiling, you agree to that. What do you have to say on that? Because while the government is saying it's good, opposition is playing really bitter, and now you are bringing in all this because it's election time. Sabka vikas abhi dikh raha hai because of election aa raha hai.
No, it's always the funder of our Honorable Prime Minister was always this. He has never spoken about petty politics any time in the last 9 years that we have seen him as a Prime Minister. He has always ensured the country's name in the world scenario is always elevated, and people take India very seriously today. the kind of the rise economically, the kind of political standing for the Prime Minister. I'm not saying just because of Mr. Modi. Recently, during the visit of German Chancellor, I had the opportunity of welcoming on behalf of our state government. I met few diplomats in the airport. They were telling me, sir, when your earlier prime ministers used to visit the Western world, there was a different kind of reception there. Today, when Modi is going there, they treat on par with any US president or any formidable nation's president. When they visit the other countries, they get a red carpet welcome. They are treated in a totally different, respectable thing. And this is what India means to the world today, the external world today. So he has made so much of difference internationally. There is no doubt about it. One may like it or hate him, but you can't deny the fact that he has ensured India's position, India's perspective in the minds of other nations is totally changed, metamorphosized today in a very positive note.
So post-COVID, I think there's a lot of stress which government and demands are stressing on mental health, which is a very good initiative.
Yes, that was our initiative. During COVID times, I got a call from Boring, initial days, in the first phase itself. So,
Victoria.
Victoria.
Yeah.
Victoria Hospital. I got a call. So my dean, he told me there was a person, he came to know about his results that he is being tested COVID positive. He went into the bathroom and he just hanged himself. So that was the state of affairs then, because they thought once COVID is there, there's no treatment, they'll die. So I immediately spoke to the director then in Nimans. I understood there is a mental trauma that is going to take place. We have to save, we have to counsel many more people to ensure that they will be taken care well. And we have counseled more than 28 lakh COVID positive people in Karnataka alone, and using digital platforms. That time you knew that there was a lockdown, we used to not meet people, there was no physical connect. So we ensured, using Rajiv Gandhi University and Nimans, we counseled more than 28 lakh positive cases. So I'm sure we would have saved many people in the process. That is when I felt mental health should be given a top priority. Unfortunately, the country did not, in other states also, there was no such mental health initiative. We started in Karnataka. Now E-Manas is there, mental health, brain health is there. Both the programs that I started in Karnataka, it has rolled out in the entire nation now from the government of India. And we started hub and spoke model from Nimans as a center to the neighboring districts. In the neighboring districts, Kolar, Chikbalapur and Bangalore rural in the last year. But this year we have expanded to all other districts in the state. We have taken all 31 districts. We are training even our PHC doctors. We are training our ASHAs. We are training our ANMs, CHOs, so that for the basic requirements they can handle situations. Because we all know that every individual in society will go through kind of stress, mental trauma once or more number of times in his lifetime. So this is normal, quite normal, because of our work or because of emotion, relationship, anything, financial situation. So we, like other countries, they give a lot of importance on mental health. Unfortunately, our country was not much into it. Our state in the last 2 years, we have taken serious note on the brain health initiative. We have expanded to every district in Karnataka this year.
So why it is difficult to get beds at Nimhans, especially when some incident happen? And you have also answered the same in the assembly, sir.
That is because it is overloaded.
There should be some
It gets
solution.
patients not just from Bangalore or Karnataka. They get patients from Tamil Nadu, they get patients from Andhra, Telangana. Unfortunately, in the entire South India, they have only one NIMHANS. In fact, when our Honorable Union Minister, Mr. Mansoor Bhai, had come recently, I had requested him, we should start something, supporting this NIMHANS in the north of Karnataka, which he has really welcomed the idea and he was positive. Maybe I expect that next year in the budget they would come out with the subsidiary of NIMHANS in the north Karnataka.
Like Jaydevite might.
Yeah, like a regional center.
Sir, many people from different parts of the state and country are looking at Karnataka as a health tourism. So, what kind of plans you have, sir, like to upgrade this?
See, luckily we have a great ecosystem, healthcare ecosystem in Karnataka. Not that I would like to take a credit for that we have started. It has been for a while now because we were the pioneers in medical education in the country. A lot of private players started their medical colleges in way back in 60s and 70s. And we had the the first and the second oldest medical colleges are from Mysore, Bangalore, So there was great emphasis laid to healthcare, and there is a good ecosystem in Karnataka. And today there are some very good hospitals where they are concentrating on this health tourism. The people from other countries who come here for their transplants, I've seen a lot of transplants that is happening in Bangalore. Similarly, even dental treatments, some root canal treatments which is so expensive abroad, they come here. We have the best people, best dentists who provide the best treatment at affordable cost. In fact, in the cost that they have to bear in US, in that cost they can come here, they can finish off their treatment, they can finish off their trip to India, and they can go back. Still they save money. So like that, India definitely, and Bangalore especially, it's an epicenter of a good healthcare in this country. So lot of our experts, specialists that we have in every domain of healthcare, they are proving out to be very, very good. And obviously people from other nations, they feel it is a natural choice of coming and taking the healthcare service in Bangalore and Karnataka. So now healthcare beyond Bangalore we need to grow. See, the challenge of healthcare always remains, it is urban centric. This should change. Every individual in the state, in the nation should get the access, and the healthcare should be available to those.
The doctors don't go to the rural places, so that is the biggest challenge.
That is why, see, with few reforms, with few laws, we have, to a great extent, we have ensured that doctors are going to the rural areas by law.
But so isn't it related to the fact that medical education itself has become unaffordable?
Expensive.
Very expensive.
I have told this in the floor of the house that in the entire world, in higher education, always medical education is expensive than all other forms of higher education. It's not just in Karnataka or India, it is a global phenomenon.
But in Ukraine and Russia, it's so cheap, sir. Even this year, some batches
You
went
can't
there.
say cheap. Even in Ukraine, if you compare the other education, higher education in that country, medical education there is higher. This is for many reasons, because today doctors, the facilities, the equipments, the kind of infrastructure that you need to put up is not an easy one. For a person who wants to build a medical college, it costs anywhere between 500 to 800 crores. We spend almost 600 to 700 crores to establish one medical college. So you can imagine what is the kind of capex that goes in, what is the kind of EMIs that will come. So it is an expensive affair. That is why our Honorable Prime Minister in the last 7-8 years, he has increased number of government medical colleges in the country. Today the PGs themselves, they are doubled in number today. So there is a lot of supply. See, when there is so much of meritorious students who can get through the seats based on their merits, they don't have to pay anything, hardly anything. You're talking about only those students who have to go for a private management, then there is a capitation involved. Even today, for a meritorious student, it is at a very affordable cost. 50,000 rupees is the fees today, a medical seat. I have not increased even a pie after me assuming as a medical education minister in the government seats.
But sir, how many people are taking private seats and how many people are taking government seats?
I'll have to give you the data.
Because
I
if
don't
they are
have it
doing,
handy.
if it's 50,000 fees, why are people going to government but they're going
Because
to
they
private?
can't
get the
compete,
ranking.
right? They have
Yeah.
to win the competition, they have to be meritorious.
So the
There is a
person
all
is-
India NEET
Yeah,
examination
yeah,
today,
yeah.
they have
Just the
to
ranking.
compete nationally now.
So if a person has written so much and he's done so much, he's studied so much, he still wants to go to a private sector and earn because he has invested so much and he says if I'm so talented, why will I work in a rural area? I might as well earn a starting salary of say 4 lakh or 5 lakh or even 12 lakh rather than going to a government where I will not get
There
money
is
and I get
always-
beaten up if a person falls ill further.
There is always a confronting debate over that. When you can earn more in city, you can also spend more in city, because living standards is more. Living standards, it's much more expensive than in a rural area. But it again depends what an individual needs. There are a lot of doctors that I know. They say at any cost they do not want to come to Bangalore. We are very happy in Mysore. We are happy in Raichur, Belgaum. There are a lot of doctors today. You can see in Hubli there are many experts who are staying in Hubli. So these are the centers that we need to strengthen our healthcare systems. So tier 2, tier 3 cities we need to really concentrate. That is why the Kidwai kind of a cancer institute, premium institute that we have, we are trying to create a lot of regional centers. Every region is getting this, so that people from Bidar need not travel for their chemotherapy to Bangalore. Similarly, the Jaydeva. Our Honorable Prime Minister will be laying the foundation for Jaydeva at Hubli. We have done it, 250 bedded Jaydeva unit. Like that, we are also coming up with new plans of reaching out to rural areas. The state of art health facilities that you have in Bangalore should be provided even in areas like Kalburgi, like in Belgaum, like in Mangalore. We are trying to do that, but it will take time.
Are you involving private sector also in that? Involving the private sector also in that?
Private sector through medical education, I think they are present everywhere today. That is why we have missed out few districts. If you have observed in Karnataka, there are private entities in those districts like Vijaypura, there are Kolar. These are all the districts where there is Bagalkot. already private entities were there. There was a program of union government that wherever the district they do not have any medical college, then the central government used to lend 60% of their capex support to the state. So center and state initiative it was. But since in these 9 districts we had a private entity, we could not get that scheme. We were not eligible for that scheme. Whereas in Tamil Nadu, they had so many districts without any medical college, even a private medical. So they automatically they got through this scheme. That is one disadvantage we had.
So coming back to the present influenza, sir. Today one death happened at Hassan. What are the challenges before the government, sir? Now that
See, this case, particular case of Hassan, the individual was 86-year-old. As I had told in my press conference also, besides suffering from H3N2 infection, people with severe morbidities and age factor, there were certain criteria. So this particular individual had other morbidities, comorbidities. So due to which he has, I think, he has laid down his life. But apart from that, we have seen the people who are infected on symptomatic treatment, they are all fine, they are all gone homes. It is not a kind of serious infection that we should be talking about or we should be worried of. It is like any other infection, influenza, based on the symptomatic treatment, they can get better. The only factor, the only thing of concern is if they are not treated well or if they develop some more complication, they may have a cough for 3 to 4 weeks, but nothing serious as losing life or anything. So people should not be really worried of this H3N2 variant. Yeah.
So COVID cases has crossed 100 now. If you look at the past 2-3 days data, so what is it we are doing and the reasons?
It's a marginal increase is there. Marginal increase in hospitalization and some ICU admissions also. But still, there is no panic button. There is no need of panic button yet. But we are watchful and we are taking all precautions and we are at the helm of things. We are talking to those hospital managements. We are talking if there is any death, we are doing a death audit also on the same day, just to understand. And once after screening, if we find that there is an infection, we are sending it to higher labs also. We are trying to know what kind of variants that this infection is. So till now we are not seeing any surprises. So to that extent, I think things are under control.
So coming to politics, how are you going to project? How do you think there are charges of corruption, serious charges of corruption?
See, corruption.
Even Law Minister yesterday gave a statement that it's really embarrassing to the government. The Madad episode.
See, I do not want to speak on an individual case, but when you talk of corruption, this government has really stood firm in attacking corruption. Though there could be a court verdict, but it was always in our manifesto in the 18th that once the government forms in our 5-year regime, we'll bring back the glory of Lokayukt, the old glory of Lokayukt. We'll strengthen in the spirit of what Lokayukta was formed for. And that is exactly we have done. We could have gone on an appeal. It's not just a court has given a direction and we have just immediately implemented. It's not like that. In several instances, government is free to go in for an appeal. But since BJP was firm, I'm not saying we have delayed by 2.5 years because of various reasons. So once the court felt that, we have also decided and we have brought back the Lokayukta in the true spirit in which it was formed. And ACP, we had to let go ACB. ACB was, though our senior opposition leader claims that there are many other states which is, which has an ACB, especially even in the states where BJP is ruling. That is why I don't believe his concept. ACB was definitely formed in this state only to ensure those allegations that were made to the then Chief Minister and to his cabinet colleagues. There were a lot of allegations, written complaints filed in Lokayukta. There were as many as 56 cases. So he had to protect his cronies. So he ensured that ACB was under him anyway. Nobody could even do an investigation. And he ensured that everybody got the B reports. This is the truth. This is the truth, whatever he may say today. But everybody understands ACB was only formed to protect the then government, the corrupt government.
Colleague, it is from
Sir.
Karnataka online, sir, Prasad.
Yes, sir.
ರೀಸೆಂಟ್ಲಿ ಆಂಬ್ಯುಲೆನ್ಸ್ ಸರ್ವಿಸಸ್ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ಸ್ ಆಗಿತ್ತು. ಸೊ ಅದ್ರ ಬಗ್ಗೆ ಈಗ ಅಪ್ಗ್ರೇಡೇಷನ್ಸ್ ಪ್ಲಾನ್ ಅಥವಾ ಇಂಪ್ರೂವೈಸೇಷನ್ ಅಂತ
ಭಾಳ ಇಂಪ್ರೂವೈಸೇಷನ್ ಆಗ್ತಾ ಇದೆ ಈಗ. ಆ್ಯಂಬ್ಯುಲೆನ್ಸ್ ಇದು ಹೆಲ್ತ್ ಎಮರ್ಜೆನ್ಸಿ ಸರ್ವಿಸ್ ಈಸ್ ಎ ವೆರಿ ಕ್ರಿಟಿಕಲ್ ಕಾಂಪೊನೆಂಟ್ ಇನ್ ಹೆಲ್ತ್ ಕೇರ್ ಡೆಲಿವರಿ ಸಿಸ್ಟಮ್ಸ್. ಸೊ ವಿ ಹ್ಯಾವ್ ಟೇಕನ್ ನೋಟ್, we have taken the experiences of the most successful systems that is available in the world today, like Singapore, Israel, US. These are the countries, they are doing very well in this space. So we have taken certain practices of them and we have tried to inculcate and to the the way that the present system is, which should suit our requirements in the state. ಇದನ್ನೆಲ್ಲ ಮಾಡಿದ್ದೀವಿ. We had engaged a lot of professionals in this to design the model. I am very sure that this will be a new benchmark of emergency health services in the country, and in the coming days I am hopeful that we will be able to get these services rolling before the code of conduct, because in the last 2.5-3 years we have fought in the court, we have fought many hurdles to reach to the situation that we are, but still people are still trying to delay things. But I am hopeful that we will roll this out for the people, for the benefit of the common man in the state.
So what made you to join politics, sir? Is it something you always wanted to be in the...
No, I was interested in social service. I was not sure whether politics was the road for it. But when I was in corporate field and I was doing a lot of public work, social service work in my constituency, in my district, then people have identified and they had requested me to join them. Somehow destiny also was there, I think.
But what is the major difference you find, sir, as a medical practitioner and the timings?
See, as a doctor, if I had practiced, I could have attended to 40-50 people. I could have treated 40-50 people in a day. But today, your one decision can change thousands of people's life, the future. Today in my regime, as a health minister, medical education. We have established 4 medical colleges and 2 more in the pipeline. So 6 medical colleges in 3 years. So there are so many super specialty hospitals we did. Upgradation of PHCs to CHCs, new health initiatives that we did. As a policy maker, you always have that advantage of uh, augmenting to so many people than just being a professional.
So I wanted to ask, since you were talking about the double engine government, right, and how it is beneficial, why has it been then in the previous 2-3 years several of the schemes, to name a few, for example the Shuchi scheme that has been there that gives sanitary napkins, or the mobile medical units under the NHM, they have been stopped and have not been rolled in the past 2-3 years. Any allocations have not also been there. Since we are talking about strengthening the primary and secondary healthcare system and the burden it will enhance, for example. So what are the difficulties that have been there? Is there any fund allocation?
There are few schemes that was there since a few years in the National Health Mission. That is the central government's initiative. But during pandemic years, we had the challenge of procurement of COVID drugs, which was really stupendous, which was Herculean task for us. So in the 2 years, there was no schools also, as you know, there was lockdowns, so many things happened. So we could not procure the Shuchi, napkins. That is one aspect. MMU also we did not do much because we were increasing the static facilities than mobile units. So in the policy we thought we should reach out to people by establishing more number of PHCs or CHCs. If you observe, today our state has more than 8 or 9,000 health and wellness centers. We appointed more than 6,000 CHOs in the last 8 months. So there was no need of MMU the way that was needed few years ago, because today facilities have increased, the infrastructure is increased, the health personnel is increased, but still we have identified few areas where it is very difficult to reach out or people to come to the facilities. So we have geographically mapped those critical areas and we have told them to roll out the MMU program in those specific, not to the extent that we had earlier. We will minimize it to the essential areas that we require. And Shuchi, it's already tendered, and from this year we have asked the education department themselves, because we have so much of drugs to be procured. So we have told education department, since you are distributing it in the schools, it is better you procure and you only supply it to the girls of government schools.
I had another question actually. Last year Karnataka we saw drug shortage of around 30 drugs primarily there persistently. This year as well, certain PHCs, health centers complain. In particular, my question is for the state medical supplies department. Why are there complaints regularly that there are so many pending bills that are not paid from the department's end?
Indian update agdiro ಕೇಸ್ಗಳು drugs.
Many PHCs don't have supply of medicines
Basic
and their bills are not.
No, you should see the history in the last 7-8 years. This year we have bought the highest number of drugs this year from the KSMCL. ಯಾವಾಗಲೂ ಕೂಡ ಈ ಕಾರ್ಪೊರೇಷನ್ ಮಾಡಿದ್ದೀವಿ ಈಗ ನಾವು. ವಿ ಹ್ಯಾವ್ ಗಿವನ್ ಎ ಕಂಪ್ಲೀಟ್ ಅಟಾನಮಿ ಟು KSMCL. ವಿ ಹ್ಯಾವ್ ಡನ್ ಎ ಕಾರ್ಪೊರೇಷನ್. ನಾವು ಬಂದಮೇಲೆ ಅದಕ್ಕೊಬ್ಬ ಎಮ್ ಡಿ ಸೀನಿಯರ್ IAS ಆಫೀಸರು ಮತ್ತು ಇಟ್ ಈಸ್ ಡನ್ ಬೈ ಕಮಿಷನರ್ ಆ್ಯಂಡ್ ಪ್ರಿನ್ಸಿಪಲ್ ಸೆಕ್ರೆಟರಿ. ಕೆಲವು ತಾವು ಹೇಳ್ದಂಗೆ ಎಮರ್ಜೆನ್ಸಿ ಡ್ರಗ್ಸು ಇಂಥದನ್ನೆಲ್ಲ ಕೂಡ ಇಫ್ ವಿ ಆರ್ ನಾಟ್ ಗೆಟಿಂಗ್ ಇನ್ ದ ಮಾರ್ಕೆಟ್, ಮತ್ತು ಈ ಹೆಲ್ತ್ ರಿಲೇಟೆಡ್ ಪ್ರೊಕ್ಯೂರ್ಮೆಂಟ್ಸ್ ಆಲ್ವೇಸ್ it gets into a lot of legal hassles. ಈ ಕಾಂಪಿಟೇಟರ್ಸ್ ಇರ್ತಾರಲ್ಲ, ಇವರು ಒಬ್ಬರ ಮೇಲೆ ಹಾಕ್ಕೊಂಡು ದೇ ವಿಲ್ ಟ್ರೈ ಟು ರೂಯಿನ್ ದ ಟೆಂಡರ್, ದೇ ವಿಲ್ ಟ್ರೈ ಟು ಕಾಂಪೀಟ್ in a unhealthy way, and they'll stall the process. In that scenario, ನಾನೇನು ಹೇಳಿದ್ದೀನಿ, ಅಂಥ ಎಮರ್ಜೆನ್ಸಿ ಕೇಸಸ್ಸಲ್ಲಿ ನೀವು ನಮ್ಮ DHOಗಳಿಗೆ ಹಣ ಕೊಟ್ಬಿಡಿ, THOಗೆ ತಾಲೂಕು ಲೆವೆಲಲ್ಲಿ ಹಣ ಕೊಡಿ, ಅವರೇ ಲೋಕಲ್ ಪ್ರೊಕ್ಯೂರ್ಮೆಂಟ್ ಮಾಡಿ ಕೊಡಲಿ ಅಂತೇಳಿ ನಾನು 3-4 ಸಲ ಹಂಗೆ ಹಣನೇ ಅವ್ರಿಗೆ ಕೊಟ್ಬಿಟ್ಟು ಮಾಡಿಸಿದ್ದೀನಿ. ಮತ್ತು ಮಿಕ್ಕಿರೋದು ಲಾಸ್ಟ್ 1.5 ಇಯರಿಂದ ಭಾಳಷ್ಟು KSMCಲಿಂದ ಪ್ರೊಕ್ಯೂರ್ಮೆಂಟ್ ಆಗಿದೆ. ಇನ್ನು ಲಾಸ್ಟ್ 10 years ಯಾವಾಗೂ ಆಗಿಲ್ಲ ಅಷ್ಟು ದೊಡ್ಡ ಸಂಖ್ಯೆಯಲ್ಲಿ ವಿ ಆರ್ ಪ್ರೊಕ್ಯೂರಿಂಗ್ ದ ಡ್ರಗ್ಸ್.
What can we expect out of this time manifesto?
Yeah, manifesto, BJP takes it very seriously. It has to be a realistic approach ಇರಬೇಕು ಅಂತ. Manifesto should be from the people, by the people and for the people ಅಂತ. ಅದಕ್ಕೋಸ್ಕರನೇ we are trying to have lot of interactions with every community, every individual, every professional. We want to reach out to as many people as possible in the state. We have set a target of reaching out to at least 1 crore people in Karnataka, taluk level, hobli level, village level. We want to understand their grievances, their aspirations, their suggestions. ಇವೆಲ್ಲವೂ ಕೂಡ ಭಾಳ ಸೀರಿಯಸ್ ಆಗಿ ತೆಗೆದುಕೊಂಡು we want to come out with a realistic, tangible manifesto, not just ಈಗ ಸುಮ್ಮನೆ ಏನೋ ಒಂದು unrealistic ಆಗಿ just keeping election in mind. We don't want to do a manifesto. That is why, though it is cumbersome process that we are involving in, we are touching more than 50 sectors actually. ಹಾಗಾಗಿ we want to reach out to every individual from different backgrounds, different professions. ಮತ್ತು ರಿಯಲಿಸ್ಟಿಕ್ ಆಗಿ knowing our budget, we have economic cell also in this. We know where we stand as a state, and we will take the next 5 years into account also. ನಮ್ಮ ಗ್ರೋತ್ ರೇಟ್ ಏನಿರುತ್ತೆ, ನಮ್ಮ ಫೈನಾನ್ಷಿಯಲ್ ಸ್ಟ್ರೆಂತ್ ಏನಿರುತ್ತೆ, what we can do, what we cannot. So we have to be realistic. We'll assure that what we can implement only we will go into assure. Because manifesto, then only it becomes credible, people can believe. Today, nobody takes manifestos of any political party seriously, because every political party tries to, tell in the manifesto they can give anything free. Anything and everything they offer free. So that should not be the intent, that should not be the way of any government. It cannot run. Government cannot run. In fact, nothing should be free.
Just a supplementary question to that, sir. When is this process likely to be completed? Number one. Number two, Congress says BJP didn't take last election manifesto seriously. Many of the promises still remain as promises. How do you respond to that?
I have given you that answer because we were not voted back to power with majority. We had no mandate on our own in 18. It was a fractured mandate. We were the single largest party. But in a political, lot of developments has taken place, and government finally came in 19, and the situation was very, very different from the normal. So we could not have implemented all those things were assured that in manifesto. But however, those important programs which were not announced in manifestos also we have been able to implement, like children of farmers children getting a scholarship for education, Raita Vidyanidhi. That is reaching out to almost 12 lakh students, and we have extended that to even weavers, children of weavers, cab drivers. So this is really a very good thing, and Stri Samarthya, Empowering Women Initiative. This is also a very unique program taken up by our Honorable Chief Minister. Like this, we have been extremely sensitive, we have been very much, we believe that empowerment can happen only through education, providing health care and women empowerment. So on these three things, the government has strongly laid a foundation. We are trying to give a lot of funds to these areas. Like this SHG groups, the Stri Samarthya, we have engaged with the Anchor Bank. And this Anchor Bank, right from the inception of the SHG, there is a guiding agency, there is a training agency, and also they will handhold them after they have come out with their products. That market, reaching out to market, whether it is a domestic market or the export, they will handhold and support them. So that is a kind of effort that this government is taking in ensuring that there is a women empowerment in a true sense.
Any more questions?
Sir, I wanted to ask you on the Chikbalapur thing, we'll come to that place, your place. So Nandi Hills project, ropeway, a lot of people are criticizing it. The government is still hell-bent on doing it despite not having environmental clearance. It's not yet, the survey is also not been done.
No, it is on
The tourism department admitted it.
tourism department is doing it on a PPP model. The tender is also floated, it is already through, and in fact in the next 3-4 days we are going ahead with this project by laying the foundation.
On private land, revenue land.
On the revenue line.
But environmental clearance?
Pardon me?
Environmental clearance?
I think the tourism department must have gone through all that legal, they must have done the legal scrutiny, I am not aware, but without legal scrutiny, without clearances, I don't think so any government would go ahead with such kind of projects, in my opinion. But since you have asked, I will definitely ask the concerned department officials.
Just one thing. So just one last thing. Sir, on the flu vaccine, 2019 you had said recently, 2019 it had stopped. And now with so many flu variants coming in, and it's so costly a vaccine also, doctors say it should be taken annually. Will the government come up with something to reduce the cost or make it free?
For the health professionals we are trying to provide. Because till 19, we have provided for health professionals working in government sector. So that we want to initiate again. We want to continue that program. In all the 31 districts, we want to provide to our health personnel.
Masses, citizens?
Never, it was never done to the masses because it's a very expensive thing. But as an advisory, I would like to request the people to take this vaccine.
So,
recently I heard that the vaccination...
The rupees 3,000 crore allegation still making rounds. Your
we have spent...
Ramaya. AG didn't give, applied for permission for a probe with your department. Your department didn't approve it.
They are trying to create a narrative of corruption on this government. It is a political narrative that they are trying to do. There is no truth in it. Because the whole COVID expenditure was around 3,000 crore. Where is the question of corruption of 3,000 crore? The whole expenditure for COVID management could be around 3,000 crores. So I can only rubbish this
Why did probe happen, sir?
Why should the probe not happen? Why should the CLP leader, the opposition leader, if he believes, why he has not filed a complaint, filed a petition in Lokayukta or in a court or wherever an investigation agency that is there? Why is he talking only in front of media? Because he wants his photograph and his allegation to be only in media. He knows that there is no truth.
So how is your relationship with him these days?
He is an opposition leader. I am a health minister in BJP party. I am a convener of manifesto committee. So I don't align to his ideals now. The way the way that the political narrative that he is trying to set in, he has become a pawn in few people's hands, in my opinion. He is not what he was as I have seen him. He has stooped below a certain kind of standards that he had. Because you need to have a kind of decorum as a former chief minister, a person who has presented 13 times a budget cannot come with flowers in his ears even before listening to the budget speech. That speaks about the hollowness in a person. That shows the hollowness, political hollowness in a leader.
Bankruptcy?
Of course.
Chief Secretary is in charge of purchase control.
ಬೂಸ್ಟರ್ ಡೋಸ್ ತಗೊಂಡ್ಮೇಲೆ
ಸರ್
ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಜಾಸ್ತಿ ಆಗ್ತಿದೆ ಅನ್ನೋ ಸುಮ್ಮನೆ ಒಂದು ರೂಮರ್ಸ್ ಓಡಾಡ್ತಿದೆ ಸರ್.
ಕರೆಕ್ಟ್, ನೀವೇ ಹೇಳಿದ್ರಲ್ಲ, ಆನ್ಸರ್ ಇದರಲ್ಲಿ ರೂಮರ್ ಅಷ್ಟೇ.
ಬಟ್ ಅದ್ರ ಬಗ್ಗೆ
Officially wanted.
ಒಂದ್ಸಲಿ ತುಂಬಾ ಜನ ಅದ್ರ ಬಗ್ಗೆ ಮಾತಾಡ್ತಿದ್ದಾರೆ ಸರ್.
ವ್ಯಾಕ್ಸಿನೇಷನ್ಗೂ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ಸ್ಗೂ ಸಂಬಂಧ ಇಲ್ಲ ಅಂತೇಳಿ ಅನೇಕ ವರದಿಗಳು ಬಂದಿದೆ. ಸೈಂಟಿಫಿಕ್ ರಿಸರ್ಚ್ ಎವಿಡೆನ್ಸಸ್ ಇದೆ. ದೇರ್ ಇಸ್ ನೋ ಟ್ರೂತ್ ಇನ್ ಇಟ್. ಅಫ್ಕೋರ್ಸ್ ಕೋವಿಡ್ ಬಂದಂಥವರು ಸಫರ್ ಆಗಿರೋಂಥವರಲ್ಲಿ ಸ್ವಲ್ಪ ಪ್ರಮಾಣದಲ್ಲಿ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್ ಆಗಿರುವಂಥದ್ದು ಕಂಡು ಬಂದಿದೆ. ಅದು ಕೂಡ ಸ್ಟಡಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅದಕ್ಕೆ ಡೈರೆಕ್ಟ್ ರಿಲೇಷನ್ ಇದೆಯಾ ಇಲ್ವಾ ಅಂತೇಳಿ. ಹೂ ಹ್ಯಾಸ್ ಸಫರ್ಡ್ ಫ್ರಮ್ ಇದು ಕೋವಿಡ್, ಹೂ ಆರ್ ದೇರ್ ಇನ್ ICU ಆನ್ ವೆಂಟಿಲೇಟರ್ ಫಾರ್ ಎ ವೆರಿ ಲಾಂಗ್ ಟೈಮ್, ಅವರಲ್ಲಿ ಕೆಲವು ಕಡೆ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ಸ್ ಆಗಿರೋವಂಥದ್ದು ಬಂದಿದೆ. ಅವೆರಡು ಕೋರಿಲೇಷನ್ ಮಾಡಿ ಸ್ಟಡಿ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ಅಂತಿಮವಾಗಿ ಇನ್ನೂ ರಿಪೋರ್ಟ್ ಬಂದಿಲ್ಲ.
Sir, you are young. Do you also long for CM position? You are very close to CM. You are right hand man of Bombay.
Then how can I aim for CM when my friend is a CM?
Next, will he be next?
No, I want him to be. I genuinely want our Bomaiji to continue as a chief minister for the kind of good work that he is doing the last 1.5 years. See, it's very difficult task for any leader to step into the shoes of a giant leader like Mr. Yediyurappa. It is not easy. In the circumstances that he was in, the way the smooth transition, the political transition took place. If you can keenly watch the kind of leader he is in the last 1.5 years, this state needs his services as CM. It should continue. This is my personal remark, however. This is my personal opinion. Of course, it is left to the High Command.
So you work with both of them, sir. What are the similarities and differences in the style of functioning, Yediyurappa and Bommai?
Yediyurappa ji is more takes decisions on instincts, on situation. Our Bomaiji, he weighs and he takes his time to take decisions. So he is a mass leader. This man is a more. He takes leaders along. He takes his time, and both are good in governance. Both are very compassionate. Both are very committed to the society. Mr. Bommai is very strong in his finances, finance control, and Yediyurappa ji is more of an emotional person. If somebody has a genuine problem, he doesn't think about what is in the store, what is in finance, what is going to be the tomorrow ramification of it. He takes the decision, and he is a mass leader. And Bomaiji has come from the basics. He has been the son of the senior Bomaiji. See, actually coming out of such a great leaders, and creating your own mark is also very difficult in any profession, because you are expected of something, because they always compare with your fathers.
Yeah.
So when you come as an individual independently, then things, there is no there is
benchmark itself is very high.
yeah, there is no expectation.
Yeah, true. The one last question, sir. I believe doctors are not getting salaries from last 2-3 months.
No,
Is it
can it
true?
be? No.
No?
That's not true. In fact, since January, on time, everybody is getting salaries. There was some finance. Adenantiri adu? What portal is that?
HRMS.
There's one more. Some technical issue was there.
Okay.
After January, even that is sorted out now. February, they have got in time. From this month, it is going to be on time.
Okay.
And in the districts, we give it to the societies, which is headed by the CEOs of Jilla Panchayat. So there also we are ensuring through NHMMD, we are continuously monitoring, we are ensuring that before 10th of every month, everybody should receive the salaries in time.
Even outsource ಅವ್ರಿಗೂ ಈಗ
ಅದೆಲ್ಲ ಮಾಡಿದ್ವಿ,
Just
ಅದೆಲ್ಲ
to-
ಟೇಕನ್ ಕೇರ್. ಮೊದಲೆಲ್ಲ ಇಶ್ಯೂ ಇತ್ತದು.
ಮೂರು ತಿಂಗಳು
Regarding your observation on the two chief ministers, you said Mr. Yediyurappa would instantly take a decision, whereas the public perception is also like this because for every decision he has to go to Delhi.
No, he doesn't.
We saw him
no.
traveling to Delhi
No,
more
I
often.
told you that
Yeah.
he weighs the situation, he takes his time, he consults the people. He is not instantly, he doesn't take. So every individual has their own style of functioning. So, but both are very committed. At the end of the day, that is more important. Both are committed, both are people centric, and both have been really very good chief ministers for this state in their own way and in their own right.